left rotation of T1 in a seated position.
So for example, using a live patient, a test question would possibly be such as, I want you to create left rotation of T1 in a seated position. So we've already gone through the introduction we have. The next thing, if we go through our checklist, is going to be the table. I want to make sure that where the patient's going to sit is going to be stable. They sit on this stationary one over here. Do me a favor, sir, can I have you sitting on this chair, facing pretty much towards the window over here. Patient's position, we want them in a neutral posture, legs in front of them, knees at about 90 degrees, sitting up in a nice neutral position. Segmental contact point, anatomically, probably the closest one to use is vertebral prominence. Can I have you a favor, sir? Can I have you drop your chin to your chest, please? I'm going to look for the most prominent that I can see of the spinous process. I'm going to take my index finger, move it to the one above. From here, I'm going to passively extend the head, and my index finger is on a segment that translates anteriorly, which means that must be C6, so this must be C7. I'll palpate one spinous process inferior to this is going to be T1. From here, I'll use Dr. Browning's method. I'm going to contact the lateral aspect of that T1 spinous process, spying on T2 below. Basically, first thing I'm going to do is look for joint play. I'm first going to rotate his head to the left, and I can feel separation between the two. So he has relatively normal joint play. T1 begins to translate or moves, in this case, to the right relative to the spinous process. To assess for end play, my hand here could stabilize him, hold his head here, and now I'm lightly spring lateral to medial into that spinous process. You'll notice that his torso relative to his head kind of buckles a little bit. So if I felt that I wanted to stabilize that a little bit more, I could use Dr. Browning's method. I have the same hand contact. I'm going to rotate the head until my forearm is going to cup his shoulder. I'm going to rotate, in this case, both his head and his torso until I feel pretension develop, which is right about there. And then from there, I'm going to stabilize him here, and I'm going to lightly spring from lateral to medial, from left to right, to assess left rotation. Or if I chose to use a TVP, using the different hand contact, I'd palpate one interspinous space above and over about an inch. This time I'm going to take my right hand, and I'm going to rotate his head. And now if I wanted to spring through the TVP, I'm going to stabilize his torso. So now I have his torso stabilized and his head is in full rotation. And from here I'm going to spring, in this case, from P to A. And I feel a give, and I feel a little bit of a recoil. So T1 has a good end play. It's both resilient, both giving and also against springs back. If I choose to use the spinous process, it'll probably be easier in one sense to have him turn around facing you. We'd use the exact same method we did for the TVP. The only difference was I'd be on the lateral side of the spinous process, in this case of T1. I'm going to rotate his head fully. I can feel both joint play. And as I spring through this, I position myself behind him now, so I stabilize both his torso. And now I can get my body weight behind this line of drive of lateral to medial, so I'm just going to lightly in the spring, in this case from lateral to medial. And I can feel a little bit of give and a little bit of a recoil. So that's using a spinous process. The method that you choose for the test, that is up to you.